Manual handling hazards, control and risk analysis. This is what we will be talking about, the manual handling hazard as the case might be. If you look at the pic, it will show it to you how to go, probably what are the issues that comes around. So first thing would be all about your manual handling. What is manual handling? The laws, responsibilities, the basic human anatomy, the kinetic lift, what we talk about, the posturing, ergonomics, everything we will talk about it. And lastly, probably hazards and the roll cages that comes around, safety tips for the handling purposes that we will be talking in this very short presentations, probably all about 20 odd minutes that we'll be spending around it. So come, let us understand what is manual handling. The transportation or support of load, let's say a forklift, putting down, pushing, pulling, carrying, and moving by hand or bodily heavily force. Look at the manual labor that I've been telling it to you, the way it has been pointed out, the delivery agents, perhaps. Now, similarly, if this is of a heavy load, is this the right method to go around it? So, can we avoid manual handling? Probably, can we do something with the forklift? As the case might be. So it can be anything from lifting, putting down, pushing, pulling, carrying, moving by hands or by physical force as the bodily things. I have given you certain example for you to understand as to what has been meant around it. How do we go around that needs to be there. And this is what we have been trying to tell it on a day-to-day usages and living existence that comes around it. So we will be talking about this thing is the manual handling operations. We'll talk about the general risk assessment, avoid significant risk if possible, consider mechanical and automated process thereby. If tasks cannot be automated, what is to be done and how do we record the finding and go around it. So provide training to the employees is what we are looking at times. Now let us understand the duties of the employees. The employees are legally required to take reasonable care of their health. You cannot be taking laxity with your own health. Yes, the employers are responsible for having the safety procedures in place, but if the employees are misusing them, probably it is the employee that needs to be blamed. Use available work and safety equipment in accordance with training and instruction provided. Follow appropriate system of work laid down by the employers in their manual handling policy. Use proper channel to inform management of possible hazard of shortcoming and manual handling activities thereby. This is what we are looking for it in the passage of time, the case thereby. The anatomy. Let us understand this is what we call the backbone, right? It's the front end view and it is the side view that comes around it. You know, this is the part where it has been bent around. So if you look into the side views, the lumbar area, the sacral area, the theopretic area, this is the bone that we are speaking around. Every jointers that comes around with your with your backbone. There are 33 vertebrae in any grown-up individual. Its four main areas are cervical, thorax, lumbar, sacrum, and natural curves that comes around it, as the case might be. It's a part of the healthy spine. Now, what happens with biomechanics is a part of the body which can be injured when you are handling or lifting heavy things. So, lower back or lumbar areas, the neck or the cervical regions, the arm, wrist, shoulders, knees, hands, fingers, and stomach muscle, as the case might be. And if you look into it, this is the muscle which has been explicitly told to you or shown to you at what goes wrong, what goes right. So it is all about due to the twisting and bending, overreaching, heavy loads of forces, working in a stop twisted position, sudden or unexpected movement, static or fixed postures, repetitive movement, and individual susceptibility. And that is what we are the main causes of back pain. Remember, absolute abrupt change in position, heavy loads or forces that have been taken around it, sudden movement which causes you. So let us go with the kinetic lift. Now, this is one of the best methodology to transform things. In case you don't have a trolley, can we take help of each other's? Take reasonable choice by yourself, reasonable amount of weight that you can carry it by yourself. So when you have to carry items, you do not need to do this in a safe manner. You should use the kinetic lift, which is suggested by the ways of lifting items. I recommend that you also utilize the machines for utilizing your uh, procurement of heavy things, heavy lifting and things like that. So in case the machine is not available, in case the trolley is missing, can we go for the other things? Can we pull in help from some other person? Please don't try to be a superman and probably try to do the impossible thing. Avoid lifting and bending whenever you can. Use a second person to assist as and when on required, and trolleys thereby. This is what we are looking. So when you are planning to think, stop, absolutely stop, think before you lift. Plan your lift, where the load is going out, what are the passages that you have to encounter, how are you going to move around them, do you need help? If required, solicit one. Any handling aids you can use. Is your route to destination clear? Are there any obstructions thereby? So ensure that you are stable and balanced. Adopt a stable base, keeping the lead foot flat on the floor as the case might be. So that is what you're positioning yourself to be around it. So adapt to a good postures, bend your knees, keep your back straight with your chin tucked in, lean forward slightly to get a wonderful grip around it. This is the best method wherein you are actually pulling down the thing. Set up a good first set and lift your bodies with all your legs and all your limbs. And that is not, instead of what people do is they bend it the other way around, and that is something which is not to be anticipated. Use your thigh muscles. That is what is all required. The lift. Load lift as smooth as possible. Make sure your head is in a neutral position. Keep your back straight, using your legs, not your back. Do not use your back, but use your legs, the muscle power in your legs, probably to take the lift on. Transporting the lift, remember, this is the right method where you are putting across on your belly kind of scenario. So this is a perfect method. But people, what does it do it? They are bending down. Once you start bending down, you are putting much more effort, pressure on your back. So get a firm grip. Never jerk the load. Move your feet slowly and gently. Do not run. Do not put an excessive physical limitations on your body. Keep the load close to you or reduce to the lever effect as the case might be. Reach your destination. Whenever you reach your destination, always place the load down before placing it in a final position. That is what we are looking. If possible, slide the object to reduce the load. If any load is required, again, if possible, place something on a waist height. That would be the most ideal position for you to go around it. So, practical, this is from sitting down to shifting and probably carrying it out straightforward, and then probably again sitting down to put the load back. So good technique reminder: stop, think, position your feet, adopt a good posture, get a firm grip, keep close to the load, don't jerk, move your feet, put down and then adjust. Vary the tasks accordingly. Remember the guidance for lift. I am specifically telling it to the audience of this particular video as to what are the guidance that needs to be taken care of as on when on basis. So we have the lifting and lowering for a woman approximately to the shoulder height would be 3 kgs, wherein the weight is around 7 kgs that goes around it. Elbow height would be 7 kgs. Knuckle height would be up to the 10 kgs weight approximately, and 7 kgs are light when you are hanging your weight. So this is what we are looking as for the guidance for lifting. So as you grow, you remember this is the weight where the maximum 10 kgs for the woman and 15 kgs for the gentleman out here. In between above and this is the 7 kgs approximately that we are talking around, and nothing more, nothing beyond it that we are looking forward to. Ergonomics is defined as the study of human abilities, the characteristic which affect the design, equipment, system, jobs. It aims to improve efficiency. Look what we are looking into it. The efficiency, the safety, the well-being of the operator, that is of prime importance. Yes, that is what ergonomics would all be talking about it. MSDS, uh, we have to understand the musculoskeletal disorders, a collection of disorders to the muscle, probably of the joints and the soft tissues of neck, shoulders, arm, wrist, legs, usually covered in a combination of factor which overlays the structure sufficiently. then they do not recover. The symptoms include pains, aches, heaviness, swelling, burning, shooting, pains, and loss of strength thereby. Then we have the WULS. Now, what is WULS is work-related upper limb disorder. This is one of the problem that comes around it. These are the problems which comes with your shoulder, neck, arm, forearm, elbow, wrist, hand, fingers, and so many areas. Now, what are the risks involved? Risk factors include poor postures, repetition, duration, forces, sudden exertion, psychosocial factors, impact of the environmental factor that comes around it, lack of rotations. Symptoms include tenderness, aches, pain, stiffness, tingling, and the numbness or the cramp that comes around here. The posture awareness, yes, this is very important. Muscles and joint works best when they are working around in their neutral positions. These principles are the foundation of all postural risk assessment tool. This is what you need to go around it, and that is the reason why I've been repeatedly telling you to sit down probably first before you are trying to pick up heavy weights. Even I'm asking you to sit down when you are putting down a heavy weight. So good postures and regular movement is the key to avoid injuries. Neutral postures of the neck, looking straight ahead of the spine, upright, S shape, upper arm hanging, as the case might be. And this is what we are looking at for the halfway bend level that comes across it. Forearms are handshake position. Now, this is what we are talking. How do we have it when we shake hands? The way we carry ourselves, the way we bend, the way we sit down, the way we are sitting straight, as the case might be. So the legs are standing with the knees slightly bent, legs not locked out at all of a so, giving you the right postures for maintaining sitting position. Now, people actually slump down, and that is a wrong posture that comes around it. Absolutely, keeping your back straight is the right thing. Whenever possible, ensure that the back is supported. Flat feet on the floor, avoid twisting. Stand up, stretch whenever there is a possibility of doing so. This is what has been recommended time and again. So, the principles of healthy standing is maintaining an S-shaped spine, as the case might be. It is standing desk ergonomics, probably at the 20 and at your eye level. The screen should be at an eye level. This is what we are looking forward to. Avoid working in a stooped postures. Avoid repeatedly bending, twisting, and so on and so forth, as the case might be. This is what we are looking at. This is how we should be designing our ergonomic principles, forward face postures, work points, in idle work zones, visions, operation, pedal, switches, manipulation, holding hand, postural variations in tasks for all body parts. Talks within the individual mental and skills of physical abilities is what is very important. Remember, when you are sitting down, what is to be avoided and what can be easy. Keep those things. So do not overreach your body. Work close to the body. Avoid crossing arms over the body as a time case might be. Now, talking about the hazard things, how do you carry those hazards? Probably in a roll cage safety, and this is how it has been mentioned out here. This will ensure that whatever you are carrying will not fall down. Absolutely will not fall down, and it will be much more protected as the case might be. So hazard or roll cage, as we are talking around, is running over toes, pulling, pushing injuries, cage overload or cage overturn, as the case might be. So trying to put heavier things at the bottom and lighter things on the top, on not vice versa, because then it will chances of it tumbling down is on the higher end. Cuts, abrasion from the damaged cages, weight of the cage, finger trapping, as the case might be, is all about here. We should be ensuring what goes right and what is not working. Now, how do we reduce accidents due to hazard? First and foremost, look for the faulty, any inspect anything and everything about the faulty cages to your manager. When loading and unloading, check the condition on the ground for of the hazard. What on what ground you are going to roll take the roll cage to. Use proper restraint. Apply brakes, hack doors, backstops, swinging, open. Wearing PPE, a personal protection equipment, no open toe shows. Absolutely, gloves should be available. We use a second person when moving a cage if required. Do not take the liability case of moving it all by yourself. Remember, moving a roll cage should always be push or pull. So cage manufacturer usually suggest pushing. Why? Because this keeps in front of you, the cage is in front of you, you know what is happening around it. Lower risk of catching feet and ankles, absolutely yes, you are pushing it away from your body. Better posturing, less likely to tip, definitely. When I say tip, it might tip, but not on you, obviously not on the person pushing it. So visions can be a problem, so that is what we look into it. Pulling is ankles and heels can easily get caught because you are pulling the cage towards your body. Twisting is to see the roots, absolutely. If the cage is heavy, difficult to stop, and that is where becomes an issue. So let us always undertake the safe system to work. Wheel the cage into the required position and apply brake thereby. Open the door, lock it back. Open the lid by lifting at one side and watch your fingers for trapping. Empty the cages into two hands, one at a time, always. With these few words, I'll sign off for the day. Thank you for watching this video.